Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
What do these children have in common? They're happy, they're smiling, and they all have clean, healthy mouths. Oh yes, each of these children has some kind of disability, but not one of them has the additional problems that go with an unclean or unhealthy mouth. They all have bright smiles, fresh breath, and healthy teeth and gums. This program was made for you, the parents and those who serve as parents of children with disabilities, in order to point out the necessity for home dental care.
The whole world starts with you.
Healthy teeth and gums. How is this accomplished? A healthy mouth for all children and adults depends on things like regular visits to the dentist. But it also depends upon staying away from too many sugary foods and daily cleaning of teeth and gums. It's what you and your child do at home that makes the big difference for dental health. As parents of the disabled, you are extra busy, and keeping your child's teeth and mouth clean may seem like a difficult task.
And it was really hard. I had to hold his head quite firmly and then really pry his lips apart and kind of shove the brush in there.
Some disabled children have no head control. Many children won't open their mouths, or if they do, their teeth clamp down on the toothbrush. Some parents believe that because a child cannot grasp or hold a regular toothbrush, they cannot learn to brush their own teeth. Since there are ways of making home dental care easier according to particular disabilities, several programs have been produced, one of which will meet your own special needs. For example, special methods and simple devices can make the task of home dental care a lot easier than you might expect. The program best suited for you and your child will offer specific information of this kind. But now, we want to show you why home dental care makes the big difference and what it takes on your part to prevent dental disease and to maintain a clean, healthy mouth.
It seemed like forever when he was going through it, but he does really well now, and I guess it was really worth the battle.
It may not be necessary to brush after every meal. What is required is that plaque be thoroughly removed from the teeth and gum lines once each day. Just before bedtime is best. Plaque is a sticky, almost colorless film. It is a collection of germs, and it is forming all the time in the mouth. It sticks to the teeth and gums. There's a lot of plaque on this child's teeth and gums. You can't really see it too well, can you? It's difficult to see. You can see it very clearly, however, when it's stained with this dye called disclosing solution. The germs have been stained red. Now we can see where they are. Mouthwash or mints only cover up the odor that plaque can cause. They do not remove the germs. What does plaque do in the mouth? Is it really harmful? Yes, it is harmful. It does two very bad things. It acts in the process of decaying the teeth, and it causes gum disease. Let's look first at how plaque can destroy the gums and bone that hold the teeth in the mouth. If it is not removed, the collection of germs known as plaque will infect the gums. The infection, called gingivitis, is caused by the byproducts given off by the plaque germs themselves. The gums may bleed easily. They'll become inflamed, swollen, and sometimes, but not always, sore. An odor is produced that is strong, smelly, and unpleasant. This is a case of gingivitis. At this point, proper home care methods can control the disease and can return gums to a healthy condition. If the plaque is not removed from the teeth and gum lines, it will form into hard particles called tartar or calculus, which can be removed only by a dentist or a dental hygienist. Calculus is harmful because it provides places for more plaque germs to grow, places where a toothbrush or floss can no longer reach. Plaque germs then continue to destroy the gums. They create holes or pockets around the teeth. If these deeper infections, called periodontal disease, are not treated by a dentist, the teeth become loose. Eventually they fall out because the gums and bone have been destroyed. This can happen to teeth that have no cavities at all, and it can be painful. It can happen to children, not only to adults. What can you do to prevent this gum disease? As we said, plaque is always forming in the mouth, but it takes plaque germs about 24 hours to start causing gum disease trouble. So if plaque is thoroughly removed once a day, gum disease can be prevented. Now let's look at the other bad thing that plaque does. It acts in the process of decaying the teeth. Plaque alone can cause gum disease, but plaque needs sugar to cause cavities. This is how it happens. Much of the food we eat contains the kind of sugar that plaque turns into acids. Just as strong acid can eat into hard metal, the acid produced in the mouth will put holes in the teeth. These we know as cavities or caries. Because plaque is sticky, it holds the acid in contact with the teeth. More plaque and more sugar continue the destruction. If the tooth is not treated by a dentist, decay will go to the nerve, causing severe pain, possible abscess, and possible loss of the tooth. If sugar is present in much of the food that we eat and plaque is always forming in the mouth, what can you do to prevent or to lessen tooth decay? First, visit a dentist on a regular basis, as often as he or she thinks necessary. Second, fluoride, a natural element, protects the teeth against decay. If your regular drinking water does not contain enough fluoride, your dentist may recommend fluoride treatments or prescribe drops, tablets, or vitamins with fluoride in them. Now for the important home care, the care that makes the big difference. Use a toothpaste with fluoride when removing plaque from the teeth and gum lines. Not all toothpaste with fluoride provide the same protection, so be sure to look for the seal of the American Dental Association Council on Dental Therapeutics on the carton. A small amount of paste on the brush will help prevent cavities. Deal with sugar directly. Remember, plaque is always forming in the mouth, and once the sugar hits the plaque, there's trouble. And that trouble is an acid attack on the teeth that lasts at least 20 minutes. How can you deal with sugar directly? Eliminate as many sugary foods as you can. Make a special attempt to say goodbye to sweets that stick to the teeth and to those that stay in the mouth a long time. Sticky things like caramels, toffee, any chewy candies and confections, and even dried fruits like raisins. And the long-lasting sugars like lollipops, mints, cough drops, sugared gum, and sugared soft drinks that are sipped. These things that stick to the teeth and or stay in the mouth a long time make the acid attack last even longer than the usual 20 minutes. Try to eliminate these sticky and long-lasting sugars completely. If you do offer other types of sweets, do it only with regular meals. Sugar does less damage at mealtime because saliva flow and the nutrients and minerals in good foods provide some protection. If your child needs to snack, you can offer foods and drinks that taste good but do not do the damage that sugar does. Things like fresh fruits and vegetables, not dried fruits, and not fruits and vegetables that have been canned with added sugar. Fresh fruits and vegetables are best, both for the health of the teeth and for general health. However, you can serve things like cheese cubes, olives, pretzels, soda crackers, corn curls, potato chips, and pizza. If the child is old enough, popcorn and nuts are good, if you're very sure they won't be breathed in or aspirated. Milk and unsweetened fruit and vegetable juices are good beverages. All of these foods can also be used instead of sugary sweets as rewards for good behavior. And finally, don't let your child eat or drink anything sugary at bedtime. There's less saliva flow during sleep, and acid has a heyday.
What you have seen are the causes of gum disease and of tooth decay. Plaque alone can cause gum disease. Plaque plus sugar produces the acid that causes tooth decay. You also saw the things that you can do to prevent or to control these dental diseases. To summarize, they are to remove plaque from the teeth and gum lines at least once a day, Protect teeth with fluoride in the toothpaste you use and with fluoride as prescribed by a dentist if your regular drinking water does not contain enough of this natural element. Control sugar intake. Visit a dentist on a regular basis as often as he or she thinks necessary.
There are many reasons to follow these recommendations and to avoid dental disease. Dental diseases can cause other physical problems. They cause pain. They can hamper speech. They can make it hard to chew and therefore hard to eat nutritious foods. Dental disease can cause social handicaps by affecting appearance, by causing self-consciousness and lowered self-esteem, by creating foul odors that keep other people at a distance. Everyone is liable to get dental disease, but among the disabled, some types of handicap make dental disease even more likely, and quite often the course of the disease will be speeded up. When dental diseases are neglected, treatment by a dentist becomes very expensive and takes a great deal of time. In some cases of long dental neglect, hospitalization may be required, with the necessary dental work carried out under general anesthesia, and this, of course, always involves risk for the child. It is very sad when children suffer the effects of dental disease because these things can be prevented. Besides avoiding disease, there are many other reasons to keep teeth clean. A person with clean teeth looks better, has fresh breath, makes a better first impression on others, feels better about himself, and is generally more attractive to other people. Daily plaque removal is an important habit to get into. The benefits are great. This program was made for you, the parents and those who serve as parents of disabled children. It showed that what you do at home makes the big difference for dental health. It showed how special methods and devices can solve tooth cleaning problems that seem big. The next videotape that you will see is entitled, How to Remove Plaque and How to Teach Self-Care.
And we're going to just jiggle it. Can you feel it next to your gum? Can you?
Yeah.
All right, and now we're going to move it back slowly.
It will show effective toothbrushing and flossing methods. It will also show how to teach your child to do as much as he or she can alone or with help.
Back and forth, back and forth. Good. See, that was good. Yeah.
4 more programs have also been produced. Each presents dental implications according to age and particular disability of the child or young adult. These are preschool children with handicaps, children and young adults with cerebral palsy or spinal cord injuries, children and young adults with mental impairments, and children and young adults with severe multiple handicaps.
When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining.
For a person with a disability, proper home care of the teeth may be a major activity,
Bring on the rain, so stop your
but the rewards are well worth the trouble.
Keep on smiling, 'cause when you're smiling, the whole world smiles with you. But when you're crying, you bring on the rain, so stop your sighing. Be happy again. Keep on smiling, 'cause when you're smiling, the whole world smiles with you.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.